So, hello, this is Dr. Rakesh Sahay. I'm a professor of endocrinology at Usmania Medical College in Hyderabad, and I would like to speak to you about diabetes and COVID. If you look at coronavirus situation in the last few months, what we have seen is that there is no evidence to say that diabetics have a higher rate of infection or they are more likely to develop infection with this virus. But what is certainly seen is that diabetics tend to have a greater morbidity because of this, or rather they have a more severe manifestation. That is, many of them require to go to the hospital, get admitted in the hospital, and many of them require to be in the intensive care unit, and the mortality also is higher amongst the diabetics. As you know, overall, if you look at the overall scenario of this coronavirus disease, what we are seeing is that about 80% of people have a mild manifestations, have a mild disease, which may not have very significant problem. 20% of them require to be hospitalized, and 1 or 2% of them, or maybe 5% of them, go on to the intensive care unit and have a respiratory distress syndrome. And that is more common amongst the diabetics. So as on today, we are seeing that diabetics are not at a higher risk of developing infection, but the manifestations are the general measures which have been advised. The government is advising that, and through social media and through many places, people are getting information about these general precautions that they have to take. I will just reiterate that you should maintain a social distance from the next person. That is, at least keep a 2-meter distance from the next person. So avoid going to a public place where you have a lot of people congregating at one place. That is the place where you have to avoid going to. And the other important thing is maintaining hand hygiene, using a mask when you're going to a place outside. So these are the things that I think are very important. Even for diabetics, these are very important. Apart from maintaining your diabetes status, see that you are maintaining your diabetes in good control. And these are the things that need to be done. Beyond that, I don't think there are any specific measures that are required for diabetes. Just maintain the diabetes well, and I'm sure with the general measures you'll be able to prevent infections. So there's a lot of comments or concerns that people have about whether we can boost our immunity and prevent this infection with coronavirus. So I would say that there is no specific medicine which is going to boost the immunity. But what we have to keep in mind is that we need to follow a diet which is healthy and a balanced diet, which comprises of a lot of vegetables, fruits, and nuts. So these have antioxidants and other substances which are going to be good. The vitamins and antioxidants are provided by this sort of a balanced diet, which is rich in fruits, vegetables, and say nuts are also good. And these are important. Keep a watch on your diet, because your activity has come down now in these days when you're not working, when you're locked down at home. So that is one important aspect. The other important aspect is that exercise is also very important. Although you may not be able to go out for exercise, or you should not be going out for exercise, but you should be trying to do exercise at home itself. On the terrace, you can walk around on the terrace, or you can do yoga and other exercises which don't require you to go out. So this is also important, to keep yourself physically active and have a balanced diet, and that is going to keep your immunity high, and that is going to prevent any of these infections. There are many people who have a lot of doubts about what should be done, what should not be done, whether any medication is going to help in preventing the infection. But I don't think there's any medication. The only medication that has been recommended by the ICMR is for the use in patients who have people who are treating patients, that is healthcare workers or doctors or nurses who are treating people with coronavirus infection, or also in household context. So if you have got somebody in the house who has developed an infection, then maybe you'll be advised by a doctor to take a medicine. But other than that, I think more important is to keep your diabetes under control, keep yourself healthy, have a balanced diet, and exercise regularly. So these are the things that need to be done by a diabetic. Don't get worried or depressed or anxious, because that is again going to have a negative effect on the immunity. So being cheerful, being happy, you're at home with your family members. So be happy, be cheerful, and follow a proper diet, and that is going to help you in preventing the infection.